The new Aga Khan University Hospital's Nakawa Specialty Center, commissioned today, is a key part of the upcoming Aga Khan University's Kampala campus. The facility is planned to enable Ugandans to obtain a wide range of specialized outpatient healthcare services previously sought from abroad. Speaking at the commissioning, the Aga Khan University President Sulaiman Shahabuddin noted that this was a great milestone in healthcare provision in Uganda and East Africa generally.
Not only is the Nakawa Specialty Center ready to receive patients, but our academic facilities are more than half complete, and we are on track to begin construction of the hospital early next year.
Meanwhile, the Chief Operating Officer, Aga Khan University Outreach Health Network, East Africa, Kuram Jamal, shares some of the services to be offered at the specialized center.
In terms of diagnostic imaging, we have a whole array of services which includes X-ray, a 128-slice CT scan, mammography services, OPG and ultrasounds. We will also offer dialysis services to our patients. One of the game changer services that we are planning to introduce here is the neurophysiology.
We have 0.2 doctors per 1,000 people. In Europe, we would have 20 times that number. And so this teaching hospital is really going to shift the needle, shift the dial on capacity, on quality, on human capital development for Uganda.
For her part, State Minister for Primary Health Care, Margaret Muhanga, noted that this center would boost access to specialized quality health care to Ugandans and reduce the need to travel abroad.
Thank the Aga Khan Development Network, the teaching hospital staff that are here now, for this development that will serve all Ugandans and also will cut our costs of sending people abroad for treatment. Because I've seen state-of-the-art equipment that we see in other countries is already being established here and installed.
She commended the Aga Khan University for the massive investment in the health and education sector, pledging government's continued support to the project. Minister Muhanga expressed concern at the growing incidence of non-communicable diseases, emphasizing the need for healthy living.
75% of our disease burden right now is all preventable. If people lived serious lives and exercise their bodies, eat healthy, they would live longer.
The Nakawa Division Mayor, Paul Mugambe, lauded at the development, however, calling on Aga Khan University Hospital to consider a special package for the most vulnerable within the community.
Much as we are celebrating here and we are happy for this facility, some of them will not celebrate. Why? Because they cannot even afford to pay 10,000 to do a blood test. They cannot even afford to pay for malaria treatment of 20,000. We need to think about these people. And I'm urging these big medical facilities to earmark maybe a day or two in a month specifically for these poor people. Or find another method that can ensure that these people are also included. They are also beneficiaries of these facilities that are coming up.
A 7-story university center and a 9-story student housing building are currently under construction at the Aga Khan University's Kampala campus. Construction of the Aga Khan University Hospital, Kampala, is set to begin next year. Benjamin Jumbe, NTV Weekend Edition.
With Aga Khan University logos and the building and the